Welcome to another edition of Our City. A few things going around the city of Elizabeth this week. On Monday, when this show is being taped at 5 o'clock, I'm going to join the Rotary for the 8th annual Taste of Elizabeth, which will be held at the Renaissance Hotel in the airport at 1000 Spring Street. The Rotary Club of Elizabeth is co-sponsored by the Greater Elizabeth Chamber of Commerce, local merchants, over 40 of them, restaurants, bakeries, diners, organizations, and funds raised will support the efforts of the Rotary as they provide grants and scholarships throughout the community. For more information, you can call 451-3665. And on Tuesday this week at 3 o'clock in the afternoon, I'll attend the grand opening of the First Presbyterian Church, the Parish House, which is located at 42 Broad Street. And we had a great reenactment there yesterday at that site as well, where the British burned down the church, similar to what they did 235 years ago. Later that evening at 7 o'clock, the Elizabeth Avenue Partnership will have their annual meeting, and their partner awards ceremony will be held at the Peterstown Community Center. The gathering will serve as an update on the Elizabeth Avenue Special Improvement District. A special presentation from the Parking Authority will unveil plans for their new Mobile Now pay-by-phone app will be installed throughout the city. In addition, a partner awards ceremony will follow. Representatives from the city, the police department, and the business community will be represented. This event takes place at 418 Palmer Street in the community center. On Wednesday at 4:30, I'll attend the grand opening and a ribbon cutting, Nugent's Smokehouse Barbecue at 960 Sherman Avenue. On Thursday of this week at 10:30 in the morning, the Creative Elizabeth, a call to collaboration seminar, will be held at the First Presbyterian Church on 42 Broad Street. This discussion will consist of a diverse group of residents, community members, local business, education, community and social service, as well as faith-based, cultural, government, philanthropic sectors for creative problem-solving discussions about innovative solutions to community concerns. And on Friday, October 24th at 11:30, we'll dedicate a portion of a street in the honor of Damon Marks, located at Pearl and Bridge Street, who's going to make a presentation to our high school. And also that day, the Elizabeth High School Homecoming Queen Pageant will begin at 6 o'clock in the evening, will be held in the tea room at Edison Academy on Summer Street. And on Saturday, I'm going to attend the Financial Planning Day, located at 1164 Elizabeth Avenue, sponsored by the City of Elizabeth, the Financial Planning Association of New Jersey. Professionals will provide information on a range of topics: savings for education, family, retirement, home ownership, credit, debit repair, starting a business, and more money managing tips. This event is free, but registration is required. So for more information or register, please call 1-877-861-7826. That will also be the subject of the beginning of this evening's show. And also that day at 1 o'clock, the Health and Human Services will have their second annual Breast Cancer Awareness Walk located in Kellogg Park. And on Thursday, October 30th at 5:30, there will be a Harvest Fest at Elizabeth Portuguese Club, and this event will feature free food, hayride and games, costume, cosmet contests, and much more. And for more information, please call 820-4051. If you need any more information on these events or any other events in our city, please call our Public Information Office at 820-4124. So please stay with us. I'll be back with Jim McCarthy talking about our Financial Awareness Day.
We have some of the finest teachers in the country. And then they graduate. Kean University.
Welcome back to our city. And I'm pleased to be joined at the beginning of this show by Mr. Jim McCarthy, who is a certified financial planner and a practitioner at McCarthy Wealth Solutions, LLC. Jim, welcome to the show.
Thank you.
So tell us, first of all, Elizabeth Financial Planning Day. Have you been involved before? This is your first one?
This is my first one here in Elizabeth.
Okay, but you've been involved in Financial Planning Days
I have.
elsewhere. Tell us about your experience.
Well, the objective of Financial Planning Day is to allow people to experience firsthand how financial planning can really improve their lives. It gives us an opportunity to bring professional investment managers and professional financial planners to people that might normally not otherwise have access to sound financial planning advice.
You know, sometimes people think financial planning is only for people with a lot of money, but in essence, the people within our middle class, it's more important for.
I would agree wholeheartedly. Without a plan, you really don't know where you're going, right? I mean, it's like setting out on a vacation without knowing your destination. So it's critical to have a plan, and it helps sometimes to have somebody guide you in that.
Now, how did you get involved in this, Jim?
I'm a certified financial planner, and I'm also a member of the Financial Planning Association, so I volunteered.
And who's eligible to participate?
As far as the volunteers or people?
No, the volunteers.
You have to be a certified financial planner and a member of the Financial Planning Association.
And the people, anybody?
As far as attendees, yes, it's open to everybody. Everyone is encouraged to come with their concerns about money. Basically, these groups of financial planning associations are doing this free as a way to give back to the community to hopefully help people succeed financially.
Now, Jim, tell me some of the things that you may find when some folks sit down with you, and what kind of questions are asked of someone with your background?
Well, one of the main ones is how am I going to be able to retire? That's probably the first one.
You tell them no.
I say yes, but maybe we have to work on it a little bit.
Right.
But it's mostly, where are they going to be down the road? That's a big concern for a lot of people. I'd say the second biggest concern probably is dealing with health issues. Healthcare, obviously there's been some changes in the healthcare laws and plans, so that's a big issue. And then for younger families, a big one is saving for child's education.
And how do you advise them to go into the plans that exist in New Jersey, or what? How do you know what's right when these person sits down with you at a free seminar? And do you follow up with meetings on financial planning? How does that happen?
Well, for this particular event, the Financial Planning Day is completely free, and there's no selling. It's no strings attached. Anybody who attends will get access to the volunteer financial planners' contact information if they wish to reach out and schedule further discussions. They're free to do that, but they're under no obligation to do that. To your first question about how do you know what's the right solution, that usually involves a couple of meetings with clients to really to really understand what their needs and concerns are, what their current situation is, before you can really best advise them on how to move forward.
And when it comes to the Health Care Act, do you advise people on exactly what plan? You don't get into the planning, you just get into the financing of the Health Care Act.
Correct. We don't necessarily help them. We'll guide them to places where they can go to get adequate information to make decisions on their healthcare choices. And then, yes, we'll certainly work with them in terms of how best to pay for that. As an example, some employers have plans that offer HSA, health savings accounts. Those have benefits and pros and cons like anything does. So, we can help a client understand if that's the right choice for them and their family depending on their needs.
Well, since you mentioned that, my daughter got braces one of the first years this health savings plan came out, and it was an allowable use under the plan. So I had them deduct the money from my paycheck, which saves you money in taxes in the long run.
It does. By using an HSA.
It was like $2,000 I took out or something.
Yes, you can, there's various limits whether you're single or a family, depending on the underlying health plan, but you can contribute pre-tax, so you can lower your taxable income and save some taxes, and basically put that money into an account that then you can have medical expenses, qualified medical expenses, as you said, deducted directly from that account. So it saves the individual or the family money by saving some taxes.
And the thing about that, though, is you have to, if you don't use it, you lose it in most cases, correct?
Well, there's two different things now. You're talking about a FSA, which is called a flexible spending account, and that is a use it or lose it. You can contribute X amount of dollars during the year pre-tax, but if you haven't spent it on qualified medical expenses by the end of the year, you lose it. An HSA, which was a different type but similar, is called a health savings account. That is not. That's a permanent account. That's portable. You can take it with you if you change employers. So that's clearly an advantage over the flexible spending account. The difference is you can do, in most cases, a flexible spending account, an FSA, regardless of the type of health insurance plan you have. A health savings account, an HSA, is strictly linked to what's called a high deductible health care plan.
So tell me, if for the average person who might be watching this show or hears about it through another means, what should they bring to a financial planning day?
Well, there's a couple of tips on that. One is they should bring some relevant financial documents. So that would be like your 2013 federal tax return, any investment account statements, recent investment account statements like IRAs, 401ks from an employer or 403b. If they want to get some idea before they come this Saturday, they could go to www.financialplanningdays.org/topics. And there they'll see a list of the type of topics and questions that they could ask at the event. The other thing would be to bring a snapshot of their current financial situation, their assets, their liabilities, income and expenses. And again, at that same website, www.financialplanningdays.org. I know it's long.
Now, are there presentations at this event, Jim? Or?
There are bilingual presentations. There are one-on-one consultations available, as well as information booths.
Now, is there when you say there's no obligation, do people come here, do they have to worry about follow-up cold calls or anything like that?
No, the only thing they'll be asked to do is take a survey at the end, just so we can assess whether they really got a benefit out of it. But there'll be no follow-up whatsoever, no selling at the event or afterwards. Again, they will be given a list of the volunteer financial planners. It's up to them if they want to reach out to the financial planners.
Now, do some do that, Jim?
Occasionally, yeah. We shared a friend that we both know who I met at an event just like this, and that's exactly how we became friends and client, and she became a client.
Oh, okay.
So that's exact. Sometimes it happens, yes. It's up, but that's people who come to this event here in Elizabeth this Saturday should have no worries that any of the volunteers are going to be trying to sell them anything. They should be thinking about this as purely information gathering for themselves, and if they feel that they want to pursue that further, they'll have the resources to do that, but that's up to them.
How do you guys do in this? You naturally you're giving back to the community.
Sure.
But on occasion you'll get some clients out of this too.
Yeah, occasionally.
Yeah, which is a good thing.
There's nothing wrong with that.
Right.
But for the most part, the volunteers are really doing it because it's part of our part of what we do for our community.
And these are down around the country during the month of October.
They are. It's again, one of the sponsors is the United States Conference of Mayors, as you mentioned, and so there are a number of them around the country all around the same time.
Jim, I want to thank you for taking the time to join us on the show.
It was my pleasure.
And talking about the Certified Financial Planning Day, and I wish you well, and I thank you for volunteering your time as well.
It was a pleasure. Look forward to it.
Please stay with us after these messages. We're going to be back with more on Our City. Welcome back to Our City. I'm pleased to be joined in the second half of this show by Miss Karen Ziobro and Angelica Rodriguez, two of the public health nurses in the city of Elizabeth. Ladies, welcome to the show.
Thank you.
So we're talking about, first of all, we have a breast cancer awareness walk, but I want to talk about vaccination. And why is it important for young people or anybody to get vaccinated? Who wants to start first?
Okay, I'll start.
Yeah, go ahead, Angelica.
Okay, so it's very important to get the influenza vaccine. It's a serious disease that not a lot of people, they take it very lightly, but there's been deaths with the influenza disease, and it's important to get the vaccine.
And who should get vaccinated?
Anyone 6 months and older should get the vaccine.
Now tell me the difference, because up until a couple of years ago, my daughter used to do a flu mist thing, as opposed to getting a shot, because she didn't want to get a shot. So she would get the mist, and she would breathe this stuff.
That's correct.
Is that as effective?
Yes, that's what's called a live vaccine, whereas the injectable is an inactivated or a dead vaccine.
So the flu mist is a live vaccine.
Correct.
The live.
So is one more effective than the other?
No, they're not. No, it's just one is an injection, and then the younger children like to receive the mist because they're scared of basically getting the vaccine, I guess you can say.
Probably they don't want the shot.
They don't want the shot.
They don't want the shot.
So when is the appropriate time to get vaccinated?
Now.
Now.
You can
Now?
say, yeah,
Now.
October, usually October is when it begins, and they go all the way until May.
So the flu season though doesn't really hit till, does it?
They'll tell you that flu season starts from October. We tend to see it in this area around December or so. And then
January.
again, if you read the literature, it'll say it can go into February, But we have seen cases going all the way into, like Angelica just said, into April and May.
So, Angelica, why don't you tell us about the symptoms of the flu?
Okay. So some symptoms that you can see are fever, chills, but not everybody gets a fever. So you have fever, body aches, runny nose, stuffy nose, things like that.
And Karen, tell us about can just a common cold be masked as a flu? Does everybody that get the common cold think they have the flu, and vice versa?
People do tend to see that, but the symptoms are very different. With the flu, like Angelica said, usually you'll have a fever, you have body aches all over, whereas a cold, you don't. A cold, you're usually just coughing.
Yeah, the flu is tough. The flu is kind of knocks you out. You're at
Yes.
home, you're in bed.
Right.
The cold, you can kind of, go on with your day. You can go to work even though you shouldn't.
Right.
That's the big difference, right? I mean, I think I had the flu once. I literally was
In bed,
in
home.
bed for like 2 days.
Yes.
I mean, I just really was uncomfortable moving.
Right.
Yes.
And the older you are, the more severe
What
it
are you
is with
saying?
you. I'm not saying you're old by no means, Mayor. Hey, we're almost the same age.
So, the enterovirus that's going around, is that considered a flu? Even though it has flu-like symptoms, and sometimes you get vomiting and diarrhea. Is that associated with the flu, or it's totally different?
It's totally different. It is a virus, and we are seeing it more and more with children and children who have asthma because of the respiratory element with it. They end up in the hospital with breathing problems.
And that's passed the same way as a flu, right? That can be airborne.
That's correct.
Yes.
Where the Ebola
Droplets.
virus that we're reading about is not airborne.
No, it's
No,
not.
it's not.
You have to actually have contact with that person's body fluids.
Right, where the other one, you can get it through the air.
Through the
So,
air. If you sneeze, if you cough, that's what you're supposed to cover.
yeah, that's it. I'm glad you said that. Tell us why that's important. Young people are taught that in school, right?
Yes, they should
Kids
be.
are
And they're taught that.
How are
But
they
because
supposed to
usually, I mean, you can't tell a small child to not to cover their nose like this and then not to touch things because they're going to do it. We know we have to go and wash our hands.
Right.
Use the hand sanitizer. So a better way to teach them is like this. So it goes in here, it doesn't fly around. They're not touching it and touching everything else around them.
And how important is these stuff that we see all over? We see it here at Kane University, where you just, the clean your hands.
Oh, it's
Soap
very
and water is the best, but definitely you want to be washing your hands.
Now, there's a proper way to do this too.
That's
right?
correct.
Tell us. I mean, people think you just walk in the bathroom, use the bath, just wash it, but you're supposed to.
What we were taught is
Go
you
ahead.
wet your hands and then you have soap and you sing happy birthday. And you should be washing your hands for as long as you're singing the song happy birthday.
Just one verse.
sometimes it's two. They usually
Two.
say two.
Two
Two
verses.
verses.
Happy birthday
Two
twice.
verses, right.
Okay. So
In the hospital, they would actually stand by you and
Yes,
make sure that you're doing it for
Right.
that amount of time.
they would.
yes.
You mean patients? They would tell them.
Well, no,
or
not patients. If
nurses?
you're getting, if nurses, your supervisor, if you're getting, let's say, audited for some reason.
So
you're
that is
supposed-
part of your
that's-
training.
Yes.
Yes.
Okay. And you have to convince other people to do. I mean, who washes their hands that long? I mean, I don't.
We do.
You nurses do,
Yeah.
but the average person doesn't.
Doesn't. Yeah,
Well,
that's
we're
true.
trying to educate them. I mean, I know with my own family, I have taught them and cousins, so we are trying.
And if you're singing "Happy Birthday" in a public restroom, do people,
Nice. Sing it in your head.
do people look at you? Oh yeah, you said that together. Yeah. So everybody 6 months and older should get vaccinated. Is there an age where you shouldn't? 70s, 80s, or it doesn't
As long
matter
as you're in good health, you should receive it.
if there's other issues.
Yeah, if there's other issues, if your healthcare provider says that you cannot get it, then you shouldn't. But everybody.
And tell us about where the flu shots are administered here in the city of Elizabeth, and how do we go about doing that? We publicize it, I know, but
Our next
in.
program will be at Sampson Center this Friday. That's 800 Anna Street at 9:30. I'm sorry.
To 11.
9:30
to
to 11 o'clock
in the morning.
in the morning. You show proof that you live in Elizabeth, and we will give the vaccine.
Now, is there plenty of vaccine out there?
Yes.
Because in some years we've
We've had a
And-
shortage.
Right?
Yes.
But now
Not-
we have enough.
Now, what does this vaccine address as far as the different strains? Talk about that a little bit, because sometimes people see this in the
We
news.
have the quadrivalent available, which is 4 different strains.
So it covers H1N1, H3N2, and then influenza A and influenza B.
So does this guarantee you that you will not get the flu?
I believe it's a 98%.
There's
if
never a
we have to get-
guarantee.
Right, it's not 100%.
It's not 100%, but it will be a milder case of the flu if you were to get it.
Okay. Did you two get yours yet?
Yes.
Yes.
You did. Do you have to have a flu shot to then give others flu shots? Is that recommended or no?
It's not required, but
not
it is
required.
definitely a good idea, and we're exposed to so many sick people between the schools that we work at and our clinics. So it is
I
a
didn't
good
get mine yet. I have to.
I was going to ask
Oh.
you that.
we could have done it here.
We could have done it on TV. Yeah, that would have been great. We'll do it in the office and get the shot in the office. And to be eligible for a flu shot in Elizabeth, you just have to live here?
Yes.
Yes.
Yeah. And you can come.
Yes.
So one of the other things we have going on, and switching a little bit of gears from the flu shot a little bit, is we have a breast cancer walk on Saturday.
Yes.
And October is Breast Cancer Awareness Month.
Right.
Tell us the importance of early detection for breast cancer.
Well, the earlier that you are detected, the earlier treatment starts, and the earlier and the better survival rate that you have.
And Angelica,
Yes.
what's the age that women should get mammograms?
They usually start around 40. So 40 is the recommended age, and then every year after that, yearly, as long as you're in good health. If you have a family history, they advise 10 years before that.
Now, can men get breast cancer?
Yes.
Yes.
Yes, actually, we were talking about that. It's not something that a lot of people talk about, but yes, they can.
It's not high rates.
It's not it. The rate of the women, no, the women are diagnosed. It's in the 200,000s. The men this year or last year they were 2,000. So it's not the same, but there's no awareness for men.
There's very little education. in that
Very
area.
little education, and they're not aware. Women go. They know yearly they have to get these exams, and they're taught this by their parents, by their schools, and but not men.
So it's an interesting point you raised. So women grow up with the knowledge that there is a process that this at some point should
Right.
start.
Yes.
Right.
And the breast cancer awareness walk that we do, we do it for education purposes
Yes.
Yes.
and
To bring
hope-
awareness.
to bring awareness. So when people come see you for flu shots, would they ask questions about other issues in their life? Would they ask questions about how can I get a mammogram, or how can I get checked for other? Would they or colonoscopies? Would they ask you questions about where to go or what to do?
They haven't, but they
Sometimes.
could. And we've been giving out the information about this walk when we've been doing the flu programs this year.
And it's interesting to note that every year that we go through this, hopefully we can reach at least one person, right?
Right.
Oh, yes,
Exactly.
definitely.
That's what we would hope.
So in the flu shots, how many people do you think we give shots to? Hundreds, thousands?
Hundreds.
Oh, hundreds.
Hundreds. Yeah, we did at least 300 already, right? It
I
feels
would
like
think
we
so.
did.
So are there any good stories? Does anybody like scream or anything?
No, not with the adults.
No, the old, no?
With the children, it's a different story.
Now, can we give shots to kids, or we just do adults in our program?
The program that we have now, that's at the 800 Anna Street, that is for adults.
That's
but
for
we
18 and
have
older.
our baby clinics that they can come to.
And the babies can get them too.
Yes, we've been
Yes.
giving it to them.
And they do. Good. They might scream a little bit.
They do.
Yes, they do.
So I want to thank the two of you for taking the time to join us on the show and talk about
Thank you.
the importance of vaccinations, as well as Breast Cancer Awareness Month that we're going through here in October. Because we had a little fundraiser in the city of Elizabeth back on Denim Day.
Oh,
Yes.
Remember that?
Yes. Yes.
Kelly Vents did it. We raised $1,000 that day. So
Okay.
that was pretty good. But thank you for joining us on
Thank
the
you.
show.
Thank you for having us.
I want to thank Angelica Rodriguez, and I want to thank Miss Karen Ziobro, as well as Jim McCarthy, who was on the first part of the show. And we'll see you next week on another edition of Our City.
We have some of the finest teachers in the country. And then they graduate. Kane University.